Hello, hello. My name is Jess, and this is Patient POV. And today we're going to hear from Steph, and she has endometriosis, adenomyosis, fibromyalgia, but she also has two other conditions in particular, which is AS and HS, which are two conditions which she's going to explain very well about. So I'm not going to try to get into it. They're words I'm not great at saying, those medical words. So I'm just going to let her jump into all that. But that's what you have to look forward to. If you hear or see in the bottom corner of this video a little nose, that is Elda. She is going through crazy allergies right now. So if anybody has any recommendations for dogs with allergies, please send me a message because we've tried so much. She's currently on Reactin because we've tried the steroids and we've tried the um, oral medications and all the different stuff, and they just like were not working, or they were changing her to be like a grumpy little child. So yeah, send me recommendations, dogs with allergies. So if you do want to find me, you can find me at Jess underscore and underscore Elda, ELDA on Instagram. And then anywhere else, if you want to find me, pretty well on almost all platforms at Patient POV. And yes, please feel free to like and subscribe to the podcast. So you'll be able to always stay up to date with what's going on. You can also head over to patientpov.ca and you'll be able to see more information about episodes. I have a blog started there, which I'm trying to stay on top of. And there's also a section for freebies. So you'll be able to get some resources there as well. Um, so those are the housekeeping things. I have been doing like a challenge for the week, but I today want to share something different with you. I hope the challenges have been going well. If you haven't yet done any of the challenges or you're behind on a challenge, feel free to start it this week. But I wanted to share with you something that I read recently. I have been trying out a product from a company called Some Days. And I don't know if you guys were on TikTok around. I personally saw it on TikTok, but I guess it would have been on Instagram as well, around and Facebook around when the Calgary Stampede was happening. There was a company that was doing a period pain simulator, and they were doing it on women could try it and then like see what their period pain was considered, like what level. And like a 5 was like a normal period pain, and then a 10 was like extreme endometriosis level period pain. And then they were getting guys to do it, and then they were able to have more respect almost for women who were going through this and going about their days, or just, suffering through that pain in general. And so it was a very cool experiment, and that's how I learned about this company. So I bought some of their products because they sell period relate period pain relief products. And so one of them is like a fully natural plant-based cream, which is like supposed to help with period pain. And I absolutely love it. I wouldn't talk about a product that I didn't truly love completely. So I'm really excited to share that with you because I also have 15% off for you guys. And so I put it in my description of this podcast. But if you use Jess underscore and underscore Elda, the same as my Instagram, at checkout, you'll be able to get 15% off. And alternatively, there's a link that you can go directly to the collab space, and you'll be able to shop for products there as well. So I'm really excited for you guys to try it. And if you do, let me know what you think. But something I wanted to share with you is when you get your order, they send out a little card. And it has a beautiful message. So I wanted just to read that for you. And then we'll just jump right into the podcast episode. So on one side of this card, it says, "Your pain matters here." And on the back, it says, "Your pain is real. You deserve relief. You know your body best. Your pain is valid. Your experience matters. You are worthy of care. Your story is important. Your pain is not normal. You deserve to be heard. You deserve to be seen. It is okay not to be okay. It's okay to need rest. Your pain is not your fault. No one knows your body better than you do. You are the expert of your own experience. Your body, your choice, your health matters. You deserve pain relief options. Keep advocating for yourself. You do not deserve to be in pain. It is not all in your head, and it's not just a bad period. You don't have to do anything you don't want to do. Your body deserves love and care. Period pain is not normal. Some days, the name of the company, and it says some days are better than others. And that's the reason for the name of the company. So I just think that's absolutely amazing. I read it and I was like, oh, I have to put it up. I need to review that so often. Because I think that's especially when we're talking about like period pain in general or like females with pain sometimes in particular, that it's considered just like, oh, you're just exaggerating. And so we get into this. This is the reason I wanted to share it with you on this episode in particular, was because she was talking about period pain and how she thought it was just normal. And so this is just a reminder, period pain is not normal, especially when it affects your daily activities. That is not normal. And don't let anyone tell you that it is. So check out my bio on this episode or like the episode notes, shall I say, and you'll be able to see the link. And I absolutely love the products. So far, I've been loving it. I got the cream in particular, and they have something called a hot spell, which is like a magnesium ginger oil, which you put in your bath. And I've been getting into baths lately a little bit more than I used to because I've been able to tolerate the heat more. And I think it works so well. So I was excited to share it with you, and I thought it paired very nicely with this episode. Um, Let me know if you have any questions or comments, and there'll be a poll in case you want to participate, or there'll be a question in case you want to participate. And let me know if you need anything else, and I hope you guys all have a great week ahead. Hello, hello. How are you today?
Yeah, not too bad, thanks. How are you?
Good, thank you. Do you want to just start by giving us an introduction on who you are and kind of your health journey background?
Yeah, sure. So my name's Steph. I'm 33 and I live in the UK just outside London. And I'm probably better known as the face behind the handle of Spoonfuls of Chronic on Instagram. I have quite a few health conditions. I have ankylosing spondylitis, endometriosis, adenomyosis, hidradenitis suppurativa, and fibromyalgia.
Wonderful, yeah. And so now we've heard from a few people with endometriosis and adenomyosis, as well as a little bit of fibromyalgia. And so if people are wondering what those are, they can go back and listen to those episodes. But I'm wondering if you would be able to explain what AS is and the HS. I wasn't going to try to say the names of those, but could you just explain what those two are?
Yeah, it's taken me a long time to work out how to pronounce them
Yeah.
properly. Yeah, so ankylosing spondylitis, or I think they just changed the name actually to axial spondyloarthropathy, which is even harder to say, um, is a form of, it's an autoimmune condition. It's a form of arthritis where your body attacks your joints and then realizes the mistake it's made and then repairs it by reforming bone where it's attacked. So that's where the ankylosing bit comes from. The spondylitis is, I think they originally thought it only attacked the spine, which is where the spondyloarthritis bit comes from. But actually, recently they found as more women have been diagnosed, because when I was diagnosed about 10 years ago now, they were like, it's a man's disease, women never get it. They've realized they're wrong about that. And actually, for females, it's pretty much attacks your peripheral joints more than your spine. So I think that's why they've changed the name to spondyloarthropathy rather than spondylitis now as well.
Very interesting. Okay. And so they attacks like rheumatoid arthritis almost, where it attacks the joints, but then it tries to repair itself by making bone there. Is that correct?
Yes.
Okay.
Yeah, so you may have heard the term bamboo spine, is what they used to call ankylosing spondylitis spine because it forms bone all between the spinal joints and then it looks like a piece of bamboo,
Mm,
essentially.
okay. And how does that impact, because I'm sure it does, but how does that impact your daily life, or how are you affected by that in your daily activities?
So I think the classic signs of it are a lot of stiffness first thing in the morning,
Mm,
is what they look out for. So when you first get up, like a lot of back stiffness, a lot of joint stiffness, it can cause a bit like rheumatoid arthritis, joint swelling, and painful joints. Interestingly, it also is linked with things like something called uveitis, where it attacks your eyes. It can be linked with Crohn's. Luckily, I don't have that. And fatigue as well. It gives me a lot of fatigue.
mm.
And then the medication that you then have to take for it is immunosuppressing. So then you've got all of that on top of it to worry about, sort of catching everything. Um, and particularly for me, I work in a hospital environment. So in terms of the immunosuppression, I have to be very careful about what patients I treat because I can't go near things like tuberculosis, shingles, or COVID or anything like that.
Very interesting, yeah. And so, I'm glad you brought that up because you mentioned before that you do work in a hospital setting. And so, what do you do in the hospital setting? And then, how do you manage having a chronic condition while working in those settings?
Yeah, so I'm a physiotherapist or physical therapist, depending on what part of the world you come from. And I think actually it's the best job I could have for ankylosing spondylitis because it likes movement. The more you move, the looser you are.
Mm,
And I have quite a lot of freedom to move around a bit, sit down a bit, move around a bit, sit down a bit. So it gives me quite a lot of freedom throughout my day, really. So it suits me down to the ground. But obviously, with the fatigue and stuff, is if I'm particularly fatigued, then I do take quite a hit.
mm.
But I'm quite lucky. I live at home still with my parents. So if I am struggling, then I've got those two to, do the other bits of my life for me, make sure there's food on the table when I get home, make sure that I can't do my laundry, they'll do it for me and things like that.
Yeah, for sure. And then, how do you manage working in a little bit of a faster pace? You have to get deadlines for seeing patients and whatever, I assume. How do you manage that while managing the fatigue side of things?
I'm not really sure. I thrive on a high pressured environment, I think. And I think sometimes when you're so busy thinking about getting A, B, and C done, it's not until you sit down and you realize, and then it washes over you, and you realize either you're in a lot of pain or you're really tired. But by that point, it's coming towards the end of the day. I also am very open with my work colleagues and my bosses. They know a lot about everything. And I do advocate that if people feel comfortable to do that, it's the best thing to do because if they know, then they understand if you need to go and take a break, or if you're not actually feeling that well that day, then they understand and they're like, oh, maybe you should take it a bit easy. You can do some other stuff. And, like if I'm in a lot of pain and we've got quite heavy patients to rehab, they know that probably I shouldn't be the one to see them that day.
Yeah, I know that's nice when they're willing to work with you rather than just assume you can do what everyone else can do in quotation marks. For sure. And so work, it can be included in work or it can be work aside. What have you found any coping strategies in your day-to-day life for any of the symptoms that you've mentioned you kind of struggle with?
It's really funny because we were talking about that this morning in terms of whether I should apply for what's called over here in the UK is PIP. So it's like a disability allowance.
Mm,
And I've always been like, well, I work full time. I'm not, I shouldn't be eligible for it. But actually, my mum was like, well, when you cook, you sit down. When at the weekends, if you are struggling, you're sleeping most of the time. So I think you almost do it and you don't realize you're doing it. I think your body's quite, in your mind, is quite clever at adapting, and it's only when somebody else points it out that you realize that you're changing what you're doing effectively.
mhm,
I think heat heat. My joints love heat. My endometriosis loves heat. So if I'm struggling, I've got a heat pad. I've got one of those hot water bottles that you strap around your middle, so I can carry on doing what I'm doing. My cat's about to join us, so I'm very sorry.
No, we love pets over here. Oh, so cute. If anybody's watching online, adorable. What's your cat's name?
Her name's Pebbles.
Oh,
She's a part of, also, I think she helps a lot with my mental health and my emotional well-being.
no, for sure, for sure. And then just confirming, was there any other, you said heat, and then the chair as well, sitting down when you're doing things that you would be standing for. Is there any
Yeah.
other things that you do?
Um, I don't think so. I think I'm quite lucky in the fact that if I feel like I can't do it, I've got two people at home that can do it for me. At work, I mean, there is a bit like my dad does drive me to and from the train station when my pain is bad, because it is a 15 to 20 minute walk uphill. So
Oh,
when you're not
yeah.
feeling great, yeah, that he does that. And yeah, if I'm in a flare, my mum's, making sure that I'm eating, making sure that I've, got clean pajamas to put on and things like that. So I think those two are probably my biggest coping strategy.
Yeah, for sure. And so, your daily life, you kind of, I suppose, have a work daily life and a not working daily life. But what would kind of one of those look like in your life?
So I think my work daily life is literally I get up, I go to work, I come home. I mean, I say I'm out just outside London. I am about an hour and a half train travel outside of London every day into London to do my job. So by the time I get home, it's, get ready for the next day. So talking more about a non-work day. So if I'm off or on a weekend, I try to get up first thing, usually to feed the cat, but then also to like make sure that I'm moving around, I'm loosening up my joints. Because if I stay in bed too long, then I get super, super stiff. Even if I'm fatigued, I need to get up and move around first of all. And then I'll try and make sure I go out for a walk or whatever, just to try and get a bit of exercise in, as long as everything's not too bad. Then I am partial to an afternoon nap to try and catch up on all of the sleep that I maybe lose over the week, and catching up with all of the energy that I've expended over the week. And then in the evening, if I want to do anything socially, is the time that I'll do that.
Yeah, very nice. And then you were mentioning that you got diagnosed about 10 years ago and that they called it a man's disease sort of thing. So I am just wondering how your diagnosis journey was, especially between the man's disease as well as endometriosis. I know some people have a hard time getting that diagnosis as well. So what was it like for you?
So I think with my AS, I started having symptoms around the age of 10.
Mm.
So I got a lot of knee pain. My parents put it down to the fact that it was growing pains. I was very active. I used to ride horses. So they were like, well, you're riding a lot, you're growing a lot. And it kind of didn't go away. And my mum will always tell you that she remembers this one time we were out and we were going bowling, and I literally was doubled over on the table in pain. And she had to go round all the tables just to ask if anybody had any pain relief, because I literally couldn't move. Um, and it didn't really get any better. And I think by the age of about 15, my mum was like, maybe we should get this checked out. So we went to an orthopedic knee surgeon who just told me that I rode too much and that's why my knees hurt. And told me to stop riding, which probably, stop exercising is a really weird thing to say. Um, and gave me some orthotics to put in my shoes. And that was kind of that. And then I kind of put up with that until about the age of, I want to say 22 or 23. By this point, I worked with horses at that point, and actually one of them had injured me. So I went to a physiotherapist for an injury in my back. And he went to have a look and he lifted my leg up and the whole of my leg went numb. And he was like, I'm not touching you. There's something much more going on here than just a superficial injury. And you need to get that checked out. And my mum was like, well, we've been going back and forth for ages, nothing's happening. So you've got private health insurance, let's go private, because I'd gone through the NHS before. So he wrote a letter to a spinal surgeon that he recommended. I saw him within a week. I had an MRI within 2 days and a blood test. And then I had my diagnosis 10 years, I guess, or 14 years after my initial symptoms started.
Mm.
They did a blood test, it's called the HLA-B27 gene, and about 10% of the population have it, but only about 1% of that actually have AS.
Mm.
And he did an MRI of my back, he did a CT of my back, and he did an MRI of my knees, and basically said that I had grade 4 sacroiliitis, which is inflammation in your sacroiliac joints on both sides, which is one of the diagnosis criteria for AS,
Mm.
along with the HLA-B27 gene. And he said I was his youngest patient that he'd ever diagnosed with AS. And actually, 10 years later, my mum went to him for something else and he still remembers me.
Oh, that's you left a lasting memory in his mind for sure. Oh, that's very interesting how that A gets diagnosed, but B how long you were waiting before it was taken seriously, and then you had to go to private for it to actually get diagnosed. It's very interesting. And then how was the diagnosis journey for the endometriosis and adenomyosis?
Well, the endometriosis was actually an accident because I had appendicitis. So they went
Oh,
in, take my appendix out, and then were like, oh, by the way, you've got endometriosis. And I was like, oh, cool, thanks.
gotcha.
But my mum had endometriosis. So I think back then, I don't think you remind me saying this, but back then, a long time ago, it was kind of you just dealt with it. They didn't really have the excision surgery for it. So she was like, I was put on the pill and that was it. So I went to my GP, I was put on the pill and that was it. And that was around about 2012, I want to say. But it was getting to the point by about 2019 where it was really affecting my daily life with pain, and just not being able to do anything at that time of the month and getting pain outside of that as well. So I went back to my GP and they were like, well, you've got the diagnosis. What more are you going to do? And again, I was like, I've got private health insurance. And they were like, oh, okay, well, then we'll refer you to a gynecologist. So again, that would had to be done privately. I mean, I work for the NHS and I think it's great in some things and not so great in others. And I think diagnosing chronic health conditions, it's really not great at. So then in 2019, in June, I had my first laparoscopic surgery, and he went in, saw how bad it was, and just came straight back out again and said to me, there's too much in there to deal with by myself at this point. I need a bowel surgeon. I need you some medication to try and reduce it a little bit. And I just need a bit of time to plan. So then I was on HRT, like an injection called Zoladex, for 3 months. And then I went back in for a double surgeon operation. I was down there for about 6 hours, and they excised everything. And then I came out. And the unfortunate thing with this was I was put on a pill that he felt would work. It didn't, but it didn't. It stopped working in March 2020. And what happened in March 2020 was COVID.
Mm-hmm.
So getting an appointment was impossible. So I kind of had to bear the brunt of it from March until about July, I think. And at the time, I'd had to move out of home because I needed to be up in London on the front line dealing with all the COVID stuff that was going on. So, and then I got admitted to my hospital that I worked at, which is I really didn't want to be because I didn't want everyone to know I was in there, but I did because I had a cyst that burst on my ovary. And so I was up in London without any family or anything. And I had one work colleague who was up in the hotel with me. So she kind of looked after me while I was in hospital, got my stuff for me, and then helped me get home after I was discharged. Then I went back to him in July. He did a scan. He was like, yeah, it's back on your right ovary. It obviously hasn't worked. So then I had to wait till January 2021 to have that surgery. That worked. And then the pills he gave me did work up until about, I want to say, about 6 to 8 months ago. And I saw him again 2 weeks ago after a scan. And unfortunately, my right ovary has had its eviction notice. So I'm waiting for that surgery, which should, I think he said the wait list was about 6 to 8 months time on the NHS from now. So I'm just waiting for that. In terms of the adenomyosis, I didn't know I had it until I spoke to him in 2021 And he was like, well, yeah, you've also got adenomyosis in your womb. And I was like, but it wasn't on any of like the operation notes, or all it said was like a bulky uterus. And I think that's maybe the medical term they use for it. So that was also by accident I found out I had that as well.
Gotcha. Yeah, no, that's a lot, and I'm sorry you have to go through that, and you're currently going through that still. And so before, I know you said you had appendicitis, and that's how you found out you had endometriosis in the first place. Did you ever feel the endometriosis beforehand, or you just like assumed it was normal, or how did that happen?
I, Well, I assumed it was normal. I thought everyone had period pain. Like, when you're a teenager, they're like, oh, well, your hormones are righting themselves. It's normal to have a heavy period. It's normal to have period pain. And your friends complain about it right at school, and you're like, oh, they must have this level of pain. But
Mm,
actually, as it gets worse, as the endometriosis builds up, you realize that actually it's not normal. And I think that's almost my biggest message that I try to get across when I'm doing any advocating, or anybody asks me and says, I think I might have endometriosis. What, what should I be looking out for? Or people are at work, people are like complaining about it. And I'm like, that's not normal. It might not be endometriosis, but it is not normal to have such a bad period pain that it affects your daily life.
hmm Yeah, no,
And
for sure.
I think because, and I think it's a health inequality. I think because we're women, it wasn't worth looking into anything to do with us until 50, 60, 70, 80 years later than it was looking into male disease, and things that affect men,
hmm
even though it's 50% of the population, right? So I think that's where it comes in, is just the fact that they just don't know enough about it. GPs are very much told, oh, if they've got period pain, just stick them on the pill. It's probably a bit of a hormone imbalance, when actually, 1 in 10 women have endometriosis. And as soon as I opened up about it at work, people are like, oh, so do I, so do I, so do I. And you're like, how many women does this actually affect? Like, it's crazy.
No, for sure. Yeah, and I've said this before, and I'll say it again. Like it's crazy that chronic pain is mostly affecting women, but women weren't included in clinical trials for medications until the 90s, which was only like the last 30 years. And then even research to today, even though it's 1 in 10, um, only about like $1.40 per person with endometriosis is going towards endometriosis research compared to other conditions that are getting much more funding for research. So exactly what you're saying, like maybe it is the health inequality because it is a female, for the most part, a female condition, or those with uteruses and
Yeah.
ovaries. But yeah, and so my question would be, you do have your Instagram, and so where can people find you on Instagram? One more time, just
Yeah, my handle's at spoonfuls of chronic.
Spoonfuls of Chronic, yes. And so, what made you want to get into advocating and starting this Instagram group, and how did that happen?
Well, I think when I was first diagnosed, even with the AS back then, because that was my first official diagnosis, I tried to look, for I tried to look on the internet, I tried to look on social media, and there just wasn't a lot out there, um, you know, at all, like raising awareness of it, or kind of somebody you could relate to, or anything. And I was just like, this is crazy. And actually, if I can change one person's experience of being diagnosed or thinking they might have something, or make somebody feel a little bit less alone in what they're feeling, and that they're not alone in what they're feeling, that it is what normal for us, it's not normal for everyone else, with what you're going through, and also spread a bit of awareness, and almost so like a little bit of light relief and a bit of humor I try to include on there. It is sometimes a bit dark humor, but I think we need that sometimes. um yeah, and I just feel like if I can make somebody else feel a little bit less alone in what they're going through, then that's I've done my job, and that's why I set it up.
Yeah, no, for sure. That's amazing. And so, um, if somebody was starting their diagnosis journey for any of these conditions, think they have any of these conditions, or they just have a chronic health condition and they're in the middle of a flare, do you have any words of encouragement or any words of advice for anybody like that?
I think advocate for yourself. Don't give up. You know your body. They do not know your body. And doctors are trained to look at horses and not zebras. And a lot of our chronic illnesses are zebras. And I think just, yeah, you just need to be your biggest advocate. And it is so frustrating and it's demoralizing at times. But actually, you need to keep pushing. If you believe there's something wrong, there probably is, and you just need to advocate for yourself. And I think allowing even one person in, or if you've got a good support system, using them, because trying to get diagnosed is a long journey. I mean, I am quite a positive person in general, but I think if I said it didn't affect my mental health, it would be naive of me. It does, but I have a support system around me, so that's so important. I know some people don't have access to that, which is why I'm online, in the hope that then people do reach out all the time. And I'm always happy to reply. I'm always happy to have a conversation. I'm always happy to be that person that, you know, you just vent to, or you ask questions, or you're like, I'm not quite sure. What do you think? Or what symptoms do you get? Is this normal? That's kind of why I wanted to be out there for those people that maybe feel like they don't have anyone. But if you do, maybe just let that one person in, because you do need to talk about these things. They do eat you up inside. I think in terms of going for a flare, I think be kind to yourself. I often don't realize how sick I was until I'm out of the flare, because I'm like, oh no,
Mm.
this isn't that bad. I need to keep going. And then when I feel better, I look back and think, oh, actually, I was actually suffering quite a bit. So my New Year's resolution this year was to be kinder to myself. And if whatever you need to do to help you through that fear, just do. Um, a lot of the time, people worry about, cancelling social engagements and things like that. I am quite lucky in the fact that the friend group that I now have understand. Very quickly thinned out my friend group when I got diagnosed, and people that weren't sort of happy for me to be like, "Oh, I can't come today because of X, Y, or Z." I think if they are getting annoyed about that, then they're probably not your true friend, unfortunately.
Mm.
But I think it's surrounding yourself by people that just allow you to be you and allow you to do what you need to do to help yourself and help your body. And yeah, I think that is what I would say.
Yeah, amazing. Wonderful. Well, thank you so much for joining me. I do appreciate it.
That's all right.